So we are one of 23 accredited social work teaching partnerships in England, and we're funded by the Department for Education. We have a total of 28 partners, including local authorities, children's trusts, NHS trusts, and higher education institutes and universities. And so we work with our partners to ensure high quality social work education and social work practice across our region. One of the ways we do this is by facilitating sort of CPD opportunities like this one. And another way, one of the other ways we do this is by sort of commissioning research, such as Albert's, which he's going to talk to you about today. So if I can just ask you to turn your cameras off, please, for today, and to mute your microphones. This session is being recorded, and it will be used as a learning sort of resource on our website. So just to make you aware of that, there is a chat function. Please do use this to ask any questions that you had. I'm sure that Albert will be happy to answer these throughout the session or at the end of the session, and so he'll be referring to those as well. I'll come back on to close the session towards the end, and there'll be a link then to a survey so that you can give your feedback to us. So please do give your feedback to us. It's really important that you share your experience of this with us, so it can help us to sort of shape future learning events as well. So I hope you enjoy the session. I'm looking forward to it. I'm going to stop sharing my screen now, and I'll pass over to Albert. Okay, over to you, Albert.
Thank you very much, Deborah. Good afternoon, everybody, and welcome to my presentation of a West Midlands Regional Teaching Partnership Research Report into the involvement of people with lived experience of social work in our higher education institution social work courses. I know and I hope that we're all committed to supporting the involvement of people with lived experience, and that if necessary, we are prepared to take direct action to ensure that the voices and the expertise of people with lived experience are at the heart of all our social work institutions and our decision-making processes. I have some slides to share with you. So here is a summary of the participation research findings and recommendations. And my presentation will include a context for the research and reasons, rationales for why we've carried it out. I'll take you through a little bit the process that we used to carry out the research, and that early part will take about 12 minutes. I will then look at the findings, the main findings of the research project, and that period will take about 20 minutes to 22 minutes. And finally, the recommendations which have come out of our research. So after about 40 to 45 minutes, the presentation will end, and there'll be an opportunity to ask questions. Unfortunately, I don't have a secretary with me today, or an administrator who can take your questions by text. However, if there isn't enough time at the end to answer questions that you have, if you do text them, I will get back to you later today if we haven't actually addressed a question that you've asked. So please send it by text if it's not possible during the whole time frame available for me to answer it during this session. Now, context and rationale. I think we have somebody who is not muted, so if you could mute, please, and I will just page up. In relation to the opportunity to ask questions, there is something I would like to say. I want to assure you that I have not prepared for this question and answer session using the advice from Boris Johnson's advisor. I understand that Boris's advisor is currently studying a module entitled how to lie convincingly to adults and still remain popular. I will not be using advice from Donald Trump's advisor, as I understand he is currently in what we call an American correctional facility. I'll be taking the novel approach of answering your questions honestly and to the best of my ability. And because I'm the messenger today, my death by Microsoft Teams is possible. However, in social work, I recommend that we take the lead in reinstating the ethical idea that integrity, honesty, and transparency from all our public servants is the best policy, especially for the benefit of our most vulnerable and disadvantaged citizens. In terms of context and rationale, as you are, I'm sure, aware, the involvement of people with lived experience of social work is a regulatory requirement for qualifying social work education courses, and it's requirement 3.7 of the Social Work England Qualifying Education and Training Standards 2019, and it specifically says, people with lived experience of social work will be involved in the course. And these education and training standards apply to all social work qualifying routes. The involvement of people with lived experience is about enhancing and deepening our learning. It's about achieving better outcomes. Their involvement is an important part of achieving our aim of constantly higher standards in social work education and social work practice. However, until we carried out this research, little was known and no formal research had been conducted into the involvement of people with lived experience in higher education social work courses in the region. This research was commissioned by Zoe Yeomans, former consultant social worker with the West Midlands Teaching Partnership, on the 26th of January 2021. Zoe has moved on to another role, but as you could see from our introduction today, we have an ample replacement in Deborah Stewart, whom I'll be working in partnership with to move this agenda forward. This research meets some of the objectives included in the West Midlands Teaching Partnership 2020-21 implementation plan. For example, one of the aims of their plan last year was to obtain HEI updated reports and development plans for increased service user and carer involvement in social work education. We also understand that the teaching partnership will be informed as it goes ahead this year by some of the findings and recommendations of this report. So the title and focus of the research, it's an introductory exploration of the participation of people with lived experience of social work within higher education institutions, that's universities, in the West Midlands Social Work Teaching Partnership. The West Midlands Teaching Partnership wanted to collect data in order to, we wanted to find out what are the current numbers of people with lived experience of social work who are involved? How are they identified in order to participate? What is the diversity of the people involved in terms of their social identity, but also in terms of their lived experiences? What areas of the courses are people involved in? How are they involved? What roles do they perform? What formal and informal mechanisms are in place to support their participation? And what is the usefulness and impact of involving people with lived experience of social work within the courses? What plans do our HEI colleagues have in place to further develop the involvement of people with lived experience? And finally, what further support do our HEI colleagues need to improve the participation of people with lived experience within social work courses, but also within the West Midlands Teaching Partnership activities. So quite a wide-ranging introductory exploration. In terms of research process, a questionnaire was produced with 13 questions and some accompanying paperwork. The most important part of the accompanying paperwork was a confidentiality and protection of data commitment statement. And what we have to understand, and I'm sure most of you do, is that universities, HEIs, are independent businesses and their data is commercially sensitive. Therefore, a commitment was made that the findings in this report would be aggregate findings, summary findings, overview findings, and themes. No specific item or element of data or idea is explicitly assigned to any individual HEI or any named person who provided the data from HEIs. It was also understood during design that some language and terms used to describe groups and people is contested and is contestable. And the language remains an ongoing fluid debate, which we are open to discussion with you. This process was approved by the West Midlands Teaching Partnership in the 15th of February 21 and issued to all of our 9 HEI partners. The questionnaire was issued on the 16th of February 21. Importantly, in terms of design, most of the questions are open questions. There are a small number of questions which are closed with specific categories requiring specific answers, but most of the questions are open. So rather than providing categories or a suggested list of possible answers to be chosen under each question, there is an open reply or comment box. And what this does is it tries to capture the uniqueness, the volume, the breadth, the depth, the complexity and the diversity of what is happening at each HEI, and prevents a preset list of themes from emerging. And we think that this results in a more complex, but also perhaps more valid and reliable set of data. Here you can see the names of our 9 HEI partners who received the questionnaire. All of these are in our region. And I want to thank you again to all colleagues at these HEIs who were involved. Some of you are possibly listening now. And thank you for your responses and your contribution to this initial report. In terms of response rate, 8 of our 9 HEI partners returned questionnaires. To myself as lead researcher, a response rate of 90%. However, it's important to remember, and this will come up as I move through to the findings section, that there were a variety of levels of questionnaire completion, ranging from all questions completed by some HEIs to most questions. So there were some questions where the completion was minimal, and that will show up in some of the findings that we will see later. And more information on completion rates is available in the detailed finding sections of our report. Interestingly, the final report ran to 75 pages, something that I had not envisaged when I started out this process. And for each of the 13 questions, there is a main findings or highlight section. So if you just want to have a look at the highlights, you look at that section. And if you want to look at some of the detail, there's a detailed findings section for each question. I will be sending a copy of the final report later today to all HEI colleagues who contributed, and with Deborah's help and Rachel's help at West Midlands Regional Teaching Partnership, the report will also be available to be accessed on the West Midlands Teaching Partnership site either later today or tomorrow. I'm now going to turn to the main findings, and I will look at the highlights. We will not have time, as you would imagine, during this session to cover a 75-page report in detail, so I will look at the highlights, starting now with some of the main findings. So question 2. This was about how many people with lived experience of social work are currently involved, who are actively participating in your social work qualifying education courses. And 8 HEIs responded to this question. And from the replies, we estimated that there were approximately 200 to 250 people with lived experience of a health or social care issue or problem involved in the courses. And within that larger group, there are approximately 175 people from that 200 to 250 who have actual lived experience of social work services. It is understood that some people with lived experience, for example, of domestic abuse or substance misuse, palliative care, that their lived experiences are critical and helpful to social work students. And it is not absolutely necessary that you also have lived experience of social work, although it is important that we have a healthy number of people with lived experience of social work who can provide their expertise, and that meets the Social Work England requirement standard more closely. With this question, and with some other questions, we don't have all the data. And for example, one HEI has not responded to this question. And we also have some difficulty arriving at the exact numbers. And I want to make you aware that our HEI colleagues don't have all the data for this question or some other questions immediately available to hand. And there are a number of reasons for that. So no one person at some HEIs has all the information. Some information is not being collected or collated by our HEI colleagues, or is simply not available, or could not be provided within the data collection time frame that this project offers, which was about 3 weeks and a few days. Also, sometimes within the HEIs, there is another internal department outside of social work within the wider faculty that has data which the social work department does not have access to. And in some occasions, some of our HEI partners work with an external agency who does a lot of the coordination and facilitation of the involvement of people with lived experience. And that external agency has a lot of data which the HEI doesn't have immediate access to. Question 4. We asked how diverse in terms of social identity are the people with lived experience who are involved. With this question, there was a big variation in response rates. We asked for diversity data under the 9 most common or core features of social identity. Starting with the first area, we asked how many service users and/or carers are involved in your courses. And 8 HEIs responded to that question. And I just want to give you that data because it's quite interesting. We discovered that there are 72 service users who are involved in our HEI courses across the region. And we discovered there's a healthy number, 43 carers involved. And the 32 people identify as both service users and carers. The second category that we, by the way, I'm not showing any data at the moment. The screen is blank, and that is correct. I will come to that in a moment. So, the second category we asked HEIs to respond on in terms of diversity was the sex and gender data, and 6 HEIs responded to that. 6 HEIs responded to age data that we requested. 6 responded to colour or broad ethnicity data. Only 3 were able to give us place of birth data. We asked whether the people involved were born in the UK or outside the UK. 3 HEIs provided that data. 6 HEIs provided data about the ability status of people involved, that is, whether they were diagnosed with a disability or not. 3 HEIs provided data about sexual orientation of people involved. Only 1 HEI provided data about the spirituality of people involved, that is, whether somebody has a religious or non-religious spirituality and what the nature of that was. And only 4 HEIs provided data about the class or classes of the people involved. So from this, we were able to come up with some conclusions and some findings. And our first conclusion was that without obtaining data from a wider range of HEIs, it wasn't considered meaningful at this stage to present, to comment, or conclude on a regional basis about the identity features of place of birth, sexual orientation, spirituality, and class, because only 50% or less of the HEIs provided the diversity data about these features. So that remains an area for future research, and watch out for that in the recommendation section. However, we were able to come to some conclusions and some findings, and here's a very important one. The emerging data, and this is from 8 HEIs who provided data, and it strongly suggests that the expert voices of people with lived experience of social work who are under the age of 18, and people described as transgender, black males, black females, Asian males, or dual multiple heritage males, are currently very underrepresented in comparison to the reported numbers of people with other social identities who are involved. So what I want to confirm here to you is this idea of very underrepresented. This is not about whether or not they represent the groups within the West Midlands or within the communities. This is about a comparison between representation of other groups and these particular groups. So for example, if we take black males and black females here, how have we come to the conclusion that they're very underrepresented in comparison to other groups? Well, let me give you the figures. For 6 HEIs who responded, we discovered that there were 73 white females involved, but only 4 black females. And for 6 HEIs who provided data, we were able to discover that there were 35 white males involved, but only 2 black males. Hence our conclusion of very underrepresented for these groups and the others presented here. More data is available in the details section of my report. Question 5. We asked, how diverse are the lived experiences of social work for the people involved? And 7 HEIs answered this question. What we discovered was that the expert voices of people with lived experience of adult social work, children and family social work, physical disabilities, adult mental health, were very well represented in social work courses across the region. We discovered that the expert voices of people with lived experience of child and adolescent mental health, learning disabilities, substance misuse, hospice palliative care, sensory impairment and fostering induction were adequately represented. And whilst it must be remembered that 2 of the HEIs, that 20% of HEIs in the region, have not yet provided data about this question, the lived experience of citizens involved, the emerging data suggests that the expert voices of people with lived experience of hospital social work, HIV social work, education social work, youth offending and domestic abuse are currently underrepresented in social work courses in the region. Now, you may find that some of the groups mentioned here are well represented at one or maybe even two HEIs, but across the region, we've come to the conclusion that they are underrepresented in comparison to other groups. Question 6. We asked our colleagues in the HEIs how many people involved have had lived experience of social work in the past 12 months. 8 HEIs responded to this question, but of the 8 who responded, 3 of those said they did not know. And again, that will be for the reasons, the data reasons that I pointed out earlier, data difficulty reasons. We were able to discover that the total number of people with lived experience of social work who are involved and have had lived experience of social work services in the past 12 months, as advised by the 5 HEIs who provided data, was 45. So we came to the conclusion that more data is needed to come to firm conclusions about currency. What we are not saying is that somebody who is providing lived experience of social work to a HEI, whose experience goes back 5, 6, 7 years, we're not saying that that's irrelevant. What we are saying is that we need to have a picture of how many people are experiencing social services today and can talk to students about that experience, as well as having people with lived experience who can talk about their experiences from some years ago when social work services organization and approach was perhaps slightly different. Question 7. We asked our colleagues, what areas of HEI social work education are people with lived experience involved in? And we got replies from 8 HEIs. There is a lot of strength that we discovered within our HEI, within our universities, regarding this issue. There was evidence in the information provided that people with lived experience of social work are involved in a wide range of HEI activities, including course design, validation and revalidation, open days, admissions, student induction, module planning, management and coordination, and teaching, assessment and quality assurance. So this meets the Social Work England regulatory standards. So we think that our HEIs are doing extremely well in meeting the Social Work England standard when it comes to areas of involvement. There was evidence actually of considerable strength and best practice in co-production, particularly in the areas of admissions, teaching and assessment. And we discovered that people with lived experience of social work are involved in teaching and assessing the skills and readiness for practice on all HEI social work courses in the region. And they're involved in teaching law and policy and values and ethics in 7 out of the 8 HEIs in the region. However, we also discovered that there are small but relevant needs, areas for development in more widely involving people with lived experience of social work in open days, module planning, management and coordination, and quality assurance across all HEIs. And interestingly, people with lived experience of social work are less likely to be involved in teaching research than any other subject area. We asked our HEI colleagues, how are people with lived experience of social work involved? We wanted to discover what was the main overall approach to the involvement of people with lived experience. Were areas activities mostly led by academic staff? Or were areas activities co-produced? That is, were academics working together with people with lived experience as equal partners? Or to what extent do people with lived experience of social work lead areas and activities within the university courses? What we discovered from 8 responses from HEIs was that 4 HEIs advised that at present course activities are mostly led by academic staff. That's 50% of our courses. One HEI wrote that course activities are mostly co-produced, where academics and people with lived experience work as equal partners. And the remaining 3 HEIs advised that they mainly use a combination of academic-led, co-production, and people with lived experience of social work-led activities. And the approach of these remaining 3 HEIs, and in fact across the region really, is the approach that is used is dependent on the course activity that needs to take place. And in the detail section of our report, you see a list of areas activities that are mostly, normally, or most likely to be led by academic staff, such as teaching research. You'll see a list of activities that are most likely or normally co-produced, such as writing articles for journals and magazines. And you'll see a list of areas activities that are more likely or most likely to be led by people with lived experience, such as role play and simulation, and group work for the admissions process. We asked our HEI colleagues what formal and informal mechanisms are in place to support the participation of people with lived experience to participate. And again, we had 8 HEIs respond, which was great. And our findings were that whilst there were notable variations in the facilitation and coordination mechanisms and approaches, and in the content of induction, training and other support provided, all 8 HEIs provide facilitators, coordinators, who work directly with people with lived experience to facilitate and coordinate their involvement. All 8 HEIs provide induction, training, a series of different kinds of meetings, and payment. We found that whilst payment is available for hours and work delivered, there can be difficulties for some people with lived experience of social work with bureaucracy, with tax, and with national insurance. Interestingly, we discovered that the government allocated budget, which is done via NHS bursaries, for paying people with lived experience of social work for involvement is £7,400 per year per HEI social work department, regardless of the number of courses within that department. It's one payment of £7,400 per year. And this has not risen in the past 8 years. And when we saw this at the teaching partnership, we thought we certainly would consider lending our shoulder, our voice, to a movement which calls for an upgrading of this. And this would help to improve involvement, to deepen and strengthen and widen involvement if we could get an improvement here, and perhaps even increase the payments to people with lived experience. 10. What have you found to be the usefulness or the impact of involving people with lived experience of social work? And again, 8 HEIs responded. And our evaluations and feedback show that it makes a positive difference in 4 major areas. Firstly, it makes a positive difference to student learning. In the detailed report, you'll find a list of positive differences it makes to student learning. For example, students have fed back that live involvement gives more insight than a case study. We found that it makes a positive difference to academic staff learning. Again, there's a list of differences in the report. For example, there is the added bonus of service users and carers acting as consultants to academic staff, in as much as they keep staff up to date with the world of everyday policy and practice which they're experiencing. We found that it makes a positive difference to the people with lived experience of social work themselves who participate. Again, there's a list, but for example, members of the group reported improvement in their health and self-esteem as a result of being involved. We also found that it made a positive difference to the whole of the social work course itself. For example, it obviously meets a key regulatory requirement, but it also helps with teaching of values, the values content of the course, as we mentioned earlier. Question 11. We asked, what plans do you have to further develop the involvement and participation of people with lived experience of social work? In the detailed report, there are many plans for further development mentioned, but here is a snapshot. Many HEIs recognize the need to increase diversity in terms of social identity, and also to increase diversity in terms of lived experience, and that's great given the data that we presented earlier in terms of findings. And especially, HEIs recognize the need to involve more young people under the age of 18. They also recognize and have plans to widen co-production and expert by experience-led activities. And there are additional plans to provide additional training and more mentoring. We asked, what further support do you need to help you increase and improve participation and the impact of participation? Again, we had 8 HEIs respond to this question. And there was a clear call, interestingly, for more regional mechanisms and more regional forms to produce regional guidance, to increase the regional promotion of the idea of involvement and to get the region to involved in promoting in order to obtain more people who would like to participate or to spread information about the availability of this option for people in their lives. There was also a call to share more regional knowledge and experiences to embed best practice across the region. Interestingly, some HEIs expressed concerns about the time and space that is available to coordinators and facilitators. Coordinators and facilitators are facilitating the involvement of people with lived experience, and sometimes they find that they don't have sufficient time or space to strengthen, widen, and deepen the involvement. They also express concerns about the lack of strength and completeness of the current Social Work England standard for involving people in terms of payment and in terms of requirement of depth of involvement. And when you read the Social Work England standard, you can understand our HEI colleagues' position. I'll read it for you. The Social Work England standard says you should make sure that there is support available for service users and carers. It doesn't specify what that support is, or should be, but it does say including payment where appropriate. And some HEI colleagues feel that term, payment where appropriate, should be changed to payment. So, moving forward to question 13. We asked what further support is needed to increase and improve the participation of people with lived experience within the West Midlands Teaching Partnership activities. And our HEI colleagues weren't shy in coming forward with some recommendations here. They said that people with lived experience of social work need to have a seat at the table on the strategic board as they are currently not represented. They said people with lived experience of social work need to be involved at all levels of the West Midlands Teaching Partnership to feel valued for their contributions. They also said we should set up a regional forum or group. In addition, and this is important, they fed back that if further research occurs, it would be really helpful if longer time frames to enable co-production with people who lived experience of social work were provided. And finally, they said it would be best practice and helpful for future research on this topic to be designed and led by service users involved in social work education. So quite a few findings there, and I'm now going to turn to the recommendations which have come out of these findings. So there were 10 recommendations, most of which I will cover here, and there's additional detail in the full report. And I want to stress that these recommendations are made following an analysis of the data provided by HEI colleagues who completed and returned questionnaires. First recommendation is to ensure that a person with lived experience of receiving social work is appointed to the West Midlands Teaching Partnership Project Team. This recommendation, use of the word appointed, leaves open the conditions, the circumstances, the basis on which that happens. Recommendation 2, with the support of and under the umbrella of the West Midlands Teaching Partnership, to set up a regional working group of all the main people who coordinate and oversee the involvement and participation of people with lived experience of social work in HEI University social work courses. I certainly found from my interactions with our HEI colleagues who facilitate and oversee and coordinate a tremendous amount of commitment, tremendous amount of ideas, and people who are very interested in moving things forward. And we believe that setting up this regional group, it would be a very dynamic group that would take us forward. And this, of course, would naturally involve people with lived experience of social work, as some HEIs, directly or indirectly, employ a person or people with lived experience of social work to coordinate and oversee this key activity. Recommendation 3. Where or if regional fora or just one regional forum is established, there would need to be an initial discussion at strategic level and operational levels of the West Midlands Teaching Partnership and HEIs about how this would be funded and resourced, including how people with lived experience of social work would be paid for their work within the forum. There are many options that could be pursued here, and some of those options are listed in the report. As expected, one of the recommendations, recommendation 4, is that more detailed research is required to obtain more complete and precise data in a number of areas, as we discovered when we went through the findings. And these areas are in terms of the numbers of people with lived experience of health and social care issues, and the exact numbers of people with lived experience of social work involved. We need more detailed and complete data. We also need this for the numbers of people with lived experience of social work who provide their expertise to more than one HEI. And this prevents us from perhaps counting a person twice or maybe even 3 times if we have a person with lived experience who's providing their expertise to more than one HEI. We also need more detailed research and more complete research into the diversity of social identity, as we discovered earlier. For example, there's need to obtain more data on place of birth, sexual orientation, spirituality, and class. Obviously, if you've got a question later about why, we can answer that question. Then we also need more detailed and precise data about the numbers of people with lived experience of social work who have had lived experience of social work in the past 12 months in order to get a picture of the currency of the whole group. Recommendation 5. Individual HEI, regional, and/or West Midlands regional teaching partnership efforts and campaigns are required to enhance the involvement of people with lived experience of social work who are under the age of 18 and people described as transgender, black males, black females, Asian males, and dual multiple heritage males, because as we discovered, they are underrepresented across the region. Recommendation 7. When future participation research is undertaken by the West Midlands Teaching Partnership, people with lived experience of social work should be involved in the design, collection and reporting phases of each project. Recommendation 8. When future participation research is undertaken by the West Midlands Teaching Partnership, a time period of 4 to 6 weeks should be provided to HEI colleagues to collect and provide responses to any questionnaires from the date the questionnaire is issued. And we hope this would help our HEI colleagues to be able to provide all of the data requested. Recommendation 9 is that the West Midlands Teaching Partnership promotes and becomes an active advocate across the region for involving people with lived experience of social work in social work courses, including advocating that Social Work England and HEIs ensuring the staff involved have sufficient time, resources, support and guidance. And finally, recommendation 10, which is quite specific. West Midlands Teaching Partnership to work in partnership with HEIs, service user and care organisations and people with lived experience of social work to help develop and provide legal and policy guidance for safely involving young people and children under the age of 18 as people with lived experience of social work within HEI courses. We think this would help our HEI partners to increase and improve the numbers of people under 18 who are involved. I will now take questions. Let me reveal myself. Hopefully,
I'll start, Albert, if you want. Should I start?
Peter.
Yeah, hi. Thanks for a very detailed and meticulous report and for making the timescales. I'm not surprised with anything you found, I must say, and I'm not sure how much more research we need to find. It's quite clear that underrepresented groups aren't there. It's quite clear that the whole issue of payment is a deterrent, particularly to non-traditional groups who are involved. The very way we often advertise is by word of mouth rather than by more equal opportunities type methods. So I'd be more keen to go for some of the more operational recommendations about let's get this going, let's set some minimum targets, let's get a payment policy, let's withhold money on the grant unless you do have X number of under 18, make it more proactive rather than because, as I say, much of your research echoes national and international research about the topic, which is very validatory. I mean, that's great in many ways. It didn't have to find anything new and absolutely radical, but it's really saying what we've been told for a while. And I think there's an interesting undercurrent at the moment about how people with lived experience have been marginalised during COVID, particularly disabled people, and how many universities and organisations and government just saw it as a novelty, as a marginal add-on that could be dispensed with, rather than the people to go to for advice about how can we best get through this pandemic. So I think, and I'm well impressed that you've picked up about SWE standards and are too weak. You know, meaningful involvement, some involvement might pay if they need to be concrete and they need to be much firmer, particularly when you have got not particularly the dedicated folks who run these, facilitate these outfits, but the senior management, the financiers within universities and health and social care. You know, they're not really persuaded by the ethical issues. It's the money that we've got to get right, I'm afraid. And there is this big thing about we will only have middle class white folks monopolising these unless we do pay them for their time, value them by, and that whole national issue that you know about about the maze of NI and benefits and tax that puts off people who are a bit anxious or have a complicated enough thing already. And I think the ring fencing of monies for this kind of activity will be the one single thing that encourages more equality, of diversity and involvement. So thanks for a very comprehensive report. But my core point is, I think let's get some hard operational, not even guidelines, must-dos in there. This must happen. We've talked about it for too long, and it's going backwards, if anything, since COVID.
Yes, Peter.
But thanks very much, Albert. Yeah.
Thank you for your validatory and supportive comments. I just wanted to say to you, Peter, that I agree with you. Do you think the teaching partnership has a role to play in, if I use some of your words, hardening up on some of the regulatory requirements, looking for that, and also in issuing, with agreement, of course, this would have to be discussed and agreed, issuing some new guidance? Could the West Midlands Teaching Partnership play a role in this?
Well, I think so, yes. I think the other thing that, from my limited vantage point, I haven't worked much with the partnership personally, but I think the fact that you control some purse strings, you have considerable government backing, you know, you have got some authority. So I think to be saying you must do this and you must do that, rather than we'll debate it would be a good thing and we could enhance this, and this must happen. Because as you know, the other thing is, as soon as social workers get into practice, a lot of this working with disappears. It's hard enough to keep it going at universities. So, you know, we really need to not give the doubting Thomases or the financiers or the wriggle room. Say, look, we have to do this. We have no obligation, because as you know, at the moment, you could just do a very tokenistic. And I'm not impressed with a one member of a service user or carer on the partnership group. It needs to be at least two. I think that's pretty much a given in involving service user care for mutual support, rather than 10 professionals and one person. It also gives you a bit more range. And so I think I'm with it, but not just one person. Yeah, it must be at least two, would be my view, and a reserve if somebody's ill or whatnot.
Peter, understood, yes. Thank you very much. You're getting a lot of support from Reshma Patel. Reshma, would you like to verbalize? Would you like to verbalize anything, Reshma?
Yes, I echo everything Peter said, but more importantly, I think there is a real lack of joined up thinking, and I know it's been trialled before, but hopefully your report, Albert, should give it a bit more substance, if that makes sense, because previously I think it has been trialled, bringing people who experience services into the teaching partnership, but maybe at a time when, you know, things hadn't been thought through, if that makes sense. So I echo that, but I suppose in a way, well, a couple of questions I had was, when we're talking about how can we attract, I don't know, the everyday people, there are a couple of things come in mind, and one of them is, I'm not sure whether all the coordinators or whoever does this work actually get those opportunities all the time to go out in the field. My experience of going into communities, because you physically have to go into communities in order to be able to encourage people to see the good side of it, or, you know, what I got out of it, for example. And I don't believe that, you know, having worked in this field for quite a time, every time we just don't get the chance, because we're so busy trying to ensure that we keep the ticking going, the coordination going, you know, more co-production work going, that sort of, you know, the next bit will be research, if that makes sense, because that was one of the things that you've highlighted. So the next area that we might look at is, well, how do we bring co-production into research without thinking, actually, the travel, you know, you've heard me, Albert, talk about it before, the travellers community, other communities, but you actually physically have to go out there, I think, to actually you know, and that's just from previous advocacy work or mental health work, you know, working in campaigning organisations where I've worked. Unless you actually go out there, it doesn't actually do anything. And the last point I wanted to make before you come in, Albert, was something about a lot, and I don't know whether again Peter touched on it, was a variation in payments. And that could be something the teaching partnership could look at, because you could go to one West Midlands university and get paid X amount, and you could go to another university and get paid X amount. And so I'll be honest with you, people who experience services often choose.
Yeah, Reshma, again, thank you for supporting Peter and for the support of the project and for your enthusiasm and commitment and the work you do in your role. As you know, the recommendations cover all of the things that you have asked about. They suggest that we should come together. They suggest that the West Midlands Teaching Partnership should play a role in ensuring that facilitators, coordinators have space and support, and that we should have a regional position. So thank you very much, Reshma. Cheryl, I believe, has a question.
Yeah, thanks, Albert, and really appreciate you providing this presentation and talking through the report and recommendations. I mean, I guess I just wanted to make a comment in response to the recommendations that you've outlined, and also the comments from Peter and Reshma. So we would definitely want to set up a project group to look at the recommendations in more detail, and we will present the recommendations to our programme board on the 20th of May, and we can allocate a budget to take this work forward. We need to just think how much money we can allocate to it, and how to use any funding as effectively as possible.
Remember, Cheryl, this is being recorded, so you can't take that back now.
That's fine. I mean, I think the recommendation in relation to appointments is a challenging one in terms of getting right and what it looks like, and looking at the we just need to look at, you know, what a role would be, you know, what somebody, how they would get involved in supporting the partnership. So I think that needs further work, but I mean, that's something that a project team could look at and provide a proposal.
The recommendation understands the complexities and uses the word appointment broadly to try to move things forward and not make it too rigid or difficult for anybody. So I think there's an open discussion to be had about the nature of that and how it would work. And Peter has also suggested earlier, and I believe that the expertise of our coordinators, facilitators can be involved in this, that it would be possibly more than one person. So I think we've started a discussion about it, Cheryl. I think the nature of how it ends up, I think we're open to options there.
Okay, thank you. But yeah, we definitely do want to take this work forward.
Brilliant. And Deborah is back in action.
Yeah, I'm just Cheryl's kind of asked what we had been discussing already, which was about sort of the complexities and the sort of practicalities of appointments as well. But I'm just aware that we're sort of a minute past 2, so I might want to release people now to go to other meetings or hopefully other events of Practice Week as well.
I think, Deborah, sorry to interrupt you. Just to let colleagues know that I'm very happy to be meeting with you in the next week, I believe, and perhaps we can have a discussion and we can start to strategically develop some ideas to take forward. I want to thank everybody who came today, very briefly, and I want to thank people for their support. And I also want to reiterate that if you have any questions, my email address is in the final report. So get back in touch with me, colleagues. And thank you again, Deborah, and the West Midlands Teaching Partnership for your support as well.
Thank you. Thank you very much, Albert. It's been really interesting and informative. I look forward to working with you on it as well. And can I just direct people to the chat where Rachel has put a link to a SurveyMonkey survey just to get your feedback on the session today. So if you could click on that, it won't take too long. Just fill that in for us. That would be fantastic. Thank you. All right, well, I'll leave it there then if everyone is free to go. So thank you very much, and thank you again, Albert.
Thank you.
Thanks. Bye, everybody.